Welcome to Safest Talks, a space where experts share evidence, clinical experience, and practical insights to advance safer, high-quality patient care. In today's episode, we focus on perioperative normothermia and its essential role in patient safety. This episode is based on Safest Standard CC16, which promotes the implementation of evidence-based guidelines to prevent perioperative accidental hypothermia through continuous temperature monitoring and active warming, helping improve patient safety and surgical outcomes. Today's guest is Dr. Fernando Cassinello, Anaesthesiologist and President of SENSAR.
Hello, my name is Fernando Cassinello. I'm an anesthesiologist and president of SENSAR. SENSAR, the Spanish Anesthesia and Reanimation Safety Incident Reporting System, is a private non-profit scientific society that promotes patient safety. SENSAR acts as a partner and lead of a work package at Safest Project.
What are the challenges in applying guidelines such as continuous temperature monitoring and active warming to prevent perioperative accidental hypothermia?
The real challenge implementing guidelines is to teach all the staff and how to follow all the guidelines correctly. We do not always fulfill them in a perfect way. We have so many pressure, so many work sometimes. So education is very important. You have to teach how to do it in order to implement all the measures correctly.
How are these guidelines applied in daily clinical practice?
There are some measures you have to follow. How? First of all, keeping the operating room temperature. That should be at least at 21 degrees and above 24 in children. It seems easy, but the temperature is not always like that. So we have to follow this first rule. Second, pre-warm the patient. If you pre-warm the patient, you prevent many complications. Third, completely cover the patient to prevent hypothermia. The same you do at your bed, cover all your body. So this is also very important. You also must monitor temperature. When surgery is going to last more than 30 minutes, it's compulsory. In these cases and in children, you should use active heating with blankets and sometimes also with fluid warmers. And these are the measures of how you do it. So it's not very complicated. You have to follow them.
What factors help healthcare teams choose the most appropriate strategy for different types of patients and procedures?
Really, they are, for the people that is working, they are used to, they use a specific measure in each procedure. This is in relation of how long is the procedure. Procedure is very, very short, may not need any other measure than room temperature or cover the patients. But any procedure that goes over 30 minutes will need another type of measures like the blankets, warming blankets. So we need to know how long is the procedure. We need to know if you're gonna probably need to transfuse the patient or administer a lot of fluids. We will then use some type of measure to warm any liquid we administrate. And of course, the patient position during surgery. This is very important, and you need to know the position of the patient to decide what type of warning procedure or warning blanket you have to use.
When these guidelines are properly implemented, what impact do you observe on patient safety, clinical outcomes, and patient recovery?
There is a great impact when guidelines are properly implemented. First, a reduction in infection that you can get just with pre-warming, but also maintaining temperature in long procedures. Also, patients prefer greater comfort, of course, and have less anxiety when normothermic. You can also reduce coagulopathies and bleeding and cardiovascular complications as hypertension or myocardial ischemia. There are a lot of complications that are reduced when you maintain the correct temperature of the patient. So therefore, it is worthwhile to maintain patient temperature by implementing normothermia guidelines. So don't forget, measure temperature, cover the patient completely, and use active heating blankets.
What are the main challenges in implementing these guidelines? And if you could take one action tomorrow to improve practice, what would it be?
Well, as I said at the beginning, you have to show how to do everything. You should be the example of how to do the procedures, and you should teach and talk with all the staff in order to be a leader in maintaining the patient temperature.
SAFEST is a Horizon Europe-funded initiative dedicated to advancing safer perioperative care through collaboration, innovation, and shared learning.